Welcome to our Feeding Part 2 video, which is part of our series for understanding newborn behavior in the first few weeks of life. Now the question is your baby actually eating or just sleeping at the breast? Remember, sucking isn't always swallowing. Newborns have like zero stamina. Feeding is essentially a workout and they often drift off before the job is done. In this video, I'm going to coach you on what if baby falls asleep while feeding, how to help a sleepy baby stay engaged, what swallowing actually looks and sounds like, when sleepy actually is considered to be a problem, and how to know that your baby is getting enough. The goal is not to keep your baby awake forever, obviously. The goal is to keep them actively drinking until they have had a full feed. Before we start, who am I? I'm Dr. Sohail Merchant. I'm a family medicine doctor who takes the confusing stuff parents worry about and breaks it down into simple, practical steps. No panic, no jargon, just the stuff that you need to know. Let's get into it. My baby keeps falling asleep while feeding. Are they even getting enough? This is a very common question. What if your baby's falling asleep while feeding, right? You're feeding, they're latched, suddenly they're out. Now you're wondering what to do. Do I wake them up? Do I let them sleep? First, you should know that this is very normal in the first few weeks of life. Newborns just don't have much stamina. Feeding is work, so they eat, use energy, and drift off. Here's what I recommend. Forget the clock, okay? This is important. You want to watch and listen for active swallowing instead. What do I mean by that? Pay attention, because what you'll see when your baby's actually drinking, you'll actually see their jaw drop a little wider, then pause for a split second before it comes back up, and you may hear a tiny gulp or a soft like a k every few sucks. That pattern, suck, suck, swallow, is what transfers milk. Now, when they're just hanging out at the breast, the sucks turn lighter and faster, almost fluttery. Their jaw will move in small, quick motions with no real pause, and you hardly hear any swallows at all. That's comfort sucking, not a full feed. All right? So if your baby drifts off after a stretch of that deep suck swallow rhythm, they probably got a solid feed, and it's okay to let them sleep. If they fall asleep after only a minute or two of fluttery non-swallow sucking, that's when you gently wake them up and help them get back to active drinking. Okay? And there are some softer signs that you can look at, such as their hands. You know, like tight fists often will go with hungry, active feeding. Relaxed hands usually show that they're kind of winding down and full. It's not 100%, but these are some subtler signs. And just, you should know that on the bottle, real drinking still looks like that slower, deeper suck, swallow rhythm, okay? And just remember, if your baby's only doing those fast, shallow sucks just to keep up with the flow, they may already be full or tired. So remember, because sucking doesn't always mean eating, this is really important. And you should also keep in mind that on the breast, a baby can stay latched for a long time without actually transferring much milk. And on the bottle, a baby may keep sucking just to manage a fast flow, even if they are exhausted or already full, okay? The goal is not to keep your baby awake forever. The goal is to keep them actively drinking until they have had a full feed. So don't look at the clock, pay attention to the swallow. I often get this question, which is how to help a sleepy baby stay engaged. If your baby drifts off before they're finished, don't just wait for them to wake up. You need to reset their environment. The goal is to provide just enough sensory noise to move them from sleep mode back into eating mode. Let's talk about the big 3 resets. Number 1, skin to skin. Remove the clothes. Direct skin contact is the best way to keep a newborn alert and regulated. Number 2, the cool down. Unwrap the blankets. A warm baby is often a sleepy baby. A slightly cool baby is an eating baby, all right? Number 3, the tactical diaper change. If they're zonked, a diaper change is the perfect, gentle annoyance to just jumpstart their system for the second half of the feed. And let's talk about active engagement. Some things that you can do could involve burping and just resetting. Don't just wait for a burp. Use that upright position change to wake their brain up, all right? And then also there's like a targeted stimulation. You can kind of use these pestering motions that would kind of stimulate them, rubbing the back, tickling the feet, stroking the cheek. What you want to do is you want to tailor your strategy. If breastfeeding, keep the milk moving. Switch sides. The moment their sucking slows down or becomes fluttery, move them to the other side to trigger a fresh letdown. You can also do breast compressions. This is one of your best tools here, okay? Gently squeeze the breast when they pause. It pushes milk forward, which triggers the baby's natural reflex to swallow. Now, if bottle feeding, manage the pace, guys. The angle matters also. Hold the bottle more horizontally. If the milk floods the mouth, the baby's gonna shut down to protect their airway. And respect the pause. Let them take breaks. A bottle-fed baby should follow a rhythmic cycle. Suck, swallow, breathe, pause. If they can't find that pause, they may get overwhelmed and they may quit early. Let's talk about what swallowing actually looks and sounds like. I did touch on this earlier, but it's important enough to touch on it again and make sure that you got this thing down. Look, most parents, they expect a dramatic gulping sound and they're waiting for this big drink and then they don't hear it and they panic. I would not recommend waiting for a sound as opposed to, I would more so be looking out for the rhythm, the pattern, okay? The deep drop. You want to look for a slow, deep jaw drop. If you only see tiny, fast mouth fluttering, they're just kind of pacifying and comfort sucking. They're not really drinking. You're looking for something like, it's a pause where they make the sound k, okay? The K pause, okay? You can call it the K pause. You want to watch for a brief pause when the jaw is at its widest point. This is the moment when that mouth fills with milk before the swallow, okay? And there's this rule, 2-to-1 rule, okay? And it's a guideline, okay? Once your milk is in, you want to look for 1 swallow for every 1 or 2 sucks. If they're sucking 5 or 6 times before a single swallow, they're usually working too hard for too little reward, okay? Of course, every baby is different. Now, what you might and what you might not hear, okay? The exhale. Sometimes you'll often hear a soft or like a breathy sound right after a swallow, okay? You may or may not hear that. And just remember also volume matters. In the first 48 hours, colostrum is thick and low volume. Swallowing with this is almost silent. But silence does not mean failure here, okay? So keep that in mind when you have colostrum. And remember, once your milk comes in, usually day 3 to 5, the sounds will become more obvious. Now, red flags, the mechanical noise. I want you to pay attention. If you hear clicking, smacking, or popping, that's a sign that the seal is broken. It's not a swallow, it's more so a leak. So stop, unlatch, and reset. And I want to talk about quickly the arousal trap, why I would skip this cool cloth method. You've probably heard people say to use like a cool washcloth or even a foot tap, which I did mention earlier, to kind of wake up baby. I'm not a big fan of that, all right? That's more of an arousal trick, not really a feeding technique. You might wake the baby up, but you haven't helped them eat. It's like using a loud alarm clock to wake someone up for a marathon. Now they're awake, but they're not ready to run, okay? Instead, use the gentle resets that we talked about earlier, skin to skin, because that actually changes their internal hormones a little bit and not just their skin temperature. You can use breast compressions. This uses the milk itself to wake them up. The taste of milk is the best alarm clock there is. Position changes, moving from cradle to a football hold or vice versa. It engages their balance system naturally, okay? So stop asking, is my baby sucking? Start asking, is my baby drinking in an organized way? That's the shift that changes everything. Look for the pattern and the rhythm. The red line, when sleepy baby becomes a problem. Look, newborns are sleepy, and frankly, you grow when you sleep, okay? But they shouldn't be lethargic. And there is a massive clinical difference between a baby who is cozy and a baby who just lacks the fuel to stay awake. If your baby hits any of these following red lines that we're about to talk about, stop troubleshooting and call the office, get your baby in immediately. Number 1, the 10-minute rule. If your baby consistently falls asleep within less than 10 minutes of active feeding and you cannot get them back to swallowing using the tactical resets that we talked about earlier, like skin to skin or the breast compression or etc., then they likely are not getting enough high-calorie milk. And this also will create a cycle of exhaustion where they're too tired to eat and they're just simply too hungry to kind of sleep deeply, all right? Number 2, the diaper countdown. Numbers don't lie. You want to use the next following numbers as a guideline, okay? Like a daily minimum to track intake. Minimum, okay? Days 1 through 3, at least 1 to 3 wet diapers and stools that transition from black to green. Day 4 and on, at least 6 wet diapers and 3+ yellow CD stools every 24 hours. I like the number 6, usually anything less, I start worrying about dehydration, okay? The red flag, if the poop is still black and tarry by day 4, guys, that is a major sign that intake is too low. Let's talk about number 3, weight gain milestones. The 10% rule. It is normal to lose some weight initially, but a baby should never lose more than 10% of their birth weight, all right? And I like using day 5 as a good guideline because day 5 is like the slide. And that slide should kind of stop by day 5. Your baby should be gaining, not losing around there. But guidelines, these are not hard and fast. Day 14 is a really good marker. I usually like to use it as like a mental deadline. Again, not hard and fast, soft deadline. By then, your baby must be back to their original birth weight by 2 weeks of age. Again, this is assuming that you have a normal term baby, not a preemie, okay? Things are different for them, okay? Number 4, the unwakeable baby. If your baby is so drowsy that they do not wake up on their own for a feed for more than 4 hours in the first 2 weeks, or if they feel floppy or weak when you pick them up, they need a medical evaluation immediately. Please bring them in, all right? Trust the data, not the vibe. I don't know, parents will often tell me they seem so peaceful when they sleep. Here's the truth. A baby who isn't getting enough calories will eventually stop crying to conserve energy. Silence can be a sign of dehydration, not contentment. So don't wait and see. If you aren't hitting the diaper numbers or the weight milestones, please call your pediatrician or a lactation consultant immediately. And remember, early intervention turns a feeding crisis into a minor adjustment. All right, what is the bottom line of all this? Master the rhythm, not the clock. Look, feeding isn't a marathon or a math problem, really. It's about efficiency. Once you've used your tactical resets and confirmed a steady swallow, your job is done, okay? Stop watching the timer and start watching your baby. Moving from guessing to evidence-based feeding is how you reclaim peace of mind, all right? Your next step, during your very next feed, ignore the clock, spend 5 minutes purely counting swallows, using that 2-to-1 rule, and picking up on those patterns and those rhythms. Once you see that rhythm, you'll know you've got this thing handled. Dr. Merchant out.